Hi guys, welcome to our third episode of our new channel, Defeating Autism, where I'm going to be sharing about our personal journey with stem cells and about our son Slava's progress after his stem cell transplant on February 15th, 2024 in Vienna, Austria. So first of all, before we proceed, I wanted to apologize about the little longer delay in releasing this video than I promised. We've been a little bit under the weather, and then Slava's been having a little bit rough of a week. He doesn't really want to eat anything except for candy, and I'm sure those parents with autistic kids can relate to this problem. So, and then therefore his behavior has been affected. He's been a little cranky and throwing tantrums, so it's been a little rough. So I've been kind of waiting for the perfect moment to record it. And then I just said to myself, listen, if you're going to wait for the perfect moment, you're never going to get anything done. So anyway, here I am. It's not going to be perfect. And I'm sorry if I stumble a little bit and can't find the right words. I'm going to try my best. And if Slava starts yelling, I apologize as well. But you guys understand. So again, my goal is not perfection here. My goal is to help those parents who are looking for answers like I was, those parents who are looking for ways to help their autistic children and to find any way to make their life better. So, and I hope and I know, I'm confident that this video will be helpful because I'm going to give you some cool tips and leads. You guys can just take the information that I have, all my research that I've done, and you can build on it. You can research for yourself and, and check everything that I said against literature and what the physicians are reporting. So anyway, also wanted to ask you before I proceed, if you guys find this video helpful, please subscribe if you haven't done so already, and please put a like, give a like to this video because this will trigger YouTube to understand that this video is helpful, and it will start offering this video to more parents who are looking for information. So, in today's video, I have a little cheat sheet above my head, so I'm going to be looking over there once in a while. In today's video, I'm going to share with you, like I already mentioned, how I came to learn about stem cells. Because honestly, in America, no neurologist, no pediatrician, maybe there are some, but it didn't happen to me. Nobody told me anything ever about stem cells or hyperbaric oxygen therapy. Nothing. So all is offered to our children is therapy, ABA therapy, Slava's and feeding therapy, music therapy, speech therapy, and occupational therapy. And I'm sure there are other therapies that kids can be involved in. But those are the therapies that we are attending. So I wanted to tell you about my journey with stem cells, how I came to learn about stem cells. So I work as a transport nurse, critical care transport nurse, and we were transporting a patient to hyperbaric oxygen therapy. Actually, so the first time I transported this patient, I was pretty surprised that, we were even doing it. I've never heard of, she was actually going for wound treatment because she had a wound that needed to be healed. And actually, I learned later that wound healing is actually FDA approved in the United States for hyperbaric oxygen therapy. Okay, so short for hyperbaric oxygen therapy, so I don't have to repeat it every time, is HBOT. So I'm going to say HBOT, hyperbaric oxygen therapy. But I just wanted to share with you about this patient of mine. And this was something really short of a miracle. So we transported her several times, but the very first time I went into the hyperbaric oxygen therapy office, I actually went inside into the hyperbaric oxygen machine chamber, And because my patient was respiratory patient, she had a tracheostomy. And so I was like, well, I'm going to watch her. So I'm going to get in there with her. And so the staff gave me the 100% oxygen, because how hyperbaric oxygen HBOT works is they get you in a very high atmospheric pressure. So I think from what I just figured out, the regular sea level atmospheric pressure is 1. So for wound healing, at least for this patient, it was 2.4. So it's way, way, way higher than the airplane pressure. And then they give you 100% oxygen. They give you a mask to breathe. And so what happens is the absorption of oxygen by the tissues increases 10 to 12 times higher than just us breathing normal oxygen. And I think even way higher than just breathing 100% oxygen without the atmospheric pressure. So the atmospheric pressure is making tissues absorb that oxygen 10 to 12 times higher and faster and more efficient. And so what happens is it promotes the wound healing, and it goes to the hypoxic, meaning areas in the body that are low on oxygen, areas of the body that are inflamed, where there's some kind of problem is going on with the body. So that's where the oxygen is going, and it promotes healing. And also, one of the benefits of HBOT is growth of the stem cells. So stem cells starts releasing into the body. I mean, they produce at a higher rate, and they release into the body at I think 8 to 10 fold rate. And so there's all these brand new stem cells are floating in the body, and they also stem cells, they go into the affected areas. They also what they do is they promote healing. They promote new tissue growth. They promote growth of the new cells. So stem cells, like you will hear in one of the videos that I'm going to talk about later, where the physician is explaining about stem cells. Stem cells are the core cells. They're basic cells. I mean, they're the very first cells. From them, everything kind of grows. It's like the stem of the tree. So stem cells essential for multiplying of the other cells. So they're actually made in the bone marrow, and they become red blood cells, white blood cells, whatever cells the body needs. And then also they're able to change into other type of cells. So for example, if you put a stem cell into a muscle, it's going to become muscle cell. You put it in the brain, it's going to become brain cell. You put it in the cardiac tissue, muscle, myocardium, is going to become a heart cell. So they're able to convert into other cells. So anyway, back to the story about my patient. Let me finish that. I kind of jump from topic to topic. When I used to teach my nursing students, they always told me, Victoria, you're talking too fast. Slow down. We can't understand you. And then, I'm bouncing all over the place. I have so many ideas. And then, if I'm nervous, I'm forgetting my words. Anyway, please bear with me. I do have some really good information that I want to share. But anyway, so this is just a relaxed home video from mom to parents. Doesn't matter the level of education, but I just wanted to, in simple terms, kind of explain for those people maybe who don't understand a lot about medical stuff. But anyway, so my patient, we were all skeptical. We're like, oh, nothing's going to happen. This is ridiculous. It's a waste of money, blah, blah, blah. So we transferred her several times, and then I haven't seen her in probably 3 months. I haven't transferred this patient. Oh, let me describe the patient's condition. So she had a really severe stroke. So this patient did not even track. I don't know if you know what that means. It's like when you take a finger and I'm following the finger with my eyes, maybe not even with my head, just with my eyes. It's called tracking. So she didn't even track. She didn't follow. You do like this and she wouldn't look. She did not move any of the upper extremities or lower extremities. So she completely was contracted and she didn't even track. So severe stroke. So that was her condition. And she had a big wound And that's why she was going to HBOT therapy. So then I see her 3 months later. It was actually after we came back from Austria at the end of February. I haven't seen her probably since November or maybe beginning of December. So maybe 2 months. And I swear to you, I almost cried. I was so touched. I was like, oh my God, this is a miracle. She was moving her extremities. She was tracking. So her daughter told me she had about, see, I'm about to cry right now. I get very sensitive. This is a miracle. So she had about 38 sessions at that point, at that time, at 2.4 atmospheric pressure, hour and a half each session. So she was tracking, she was moving her extremities, and the daughter said that she was mouthing words. She was trying to reply to us. We were like, how are you doing? And she's like, fine. I was like, oh my God, this is a miracle. And so seriously, I have never seen anything like this in my life. And I've been a nurse for 20 years. And so, and her daughter said, she told her, she's like, hey, your sister called. And she goes, so what did she say? It was a miracle. And now, because me and her daughter keep in touch, and she said now she's actually trying to write. So this is seriously a pure miracle. So, oh my God. But anyway, and it's all from that oxygen being released and absorbed by the tissues, and it promotes healing and growth of the new cells, right? And from the release and the build-up and the promotion of the new stem cells, and stem cells promote healing and growth of the new cells, and decrease inflammatory process. That's what they mainly do, is decrease the inflammation. And oxygen does the same thing also. But anyway, and the staff at the HBOT office told me that they do have some autistic kids that do some sessions there, and they said some of them you can't even recognize them anymore. Like it's a different kid than when they first came. So I started doing my research about HBOT. I have family in Europe. All my family is actually in Europe. And I thought, because I haven't seen them in a while because of COVID. And I was like, well, I'll go to Europe and do it over there, even though you need a lot of sessions. For autistic kids, they recommend 1.5 to 1.7 atmospheric pressure and 40 to 60 sessions. And usually the doctor will decide however many sessions. But again, for autism, it's not FDA approved, but you still can get sessions at the local HBOT treatment centers. They have doctors that they contracted with. They will write an order. I don't know how legal it is, but that's what they told me. So, insurance is not going to pay for it, so who cares, right? Because all of this, if it was FDA approved, insurance would pay for it. But as long as you pay for it, it doesn't really matter. So, and I'm sure the physician can prescribe whatever he wants. I don't really know the legalities of all that. But anyway, I was trying to see if I can find some centers in Europe. And I came across a lecture by this doctor. His name is Cem Kinaci. He's a nuclear neuropsychiatrist from Turkey. He actually has a son who was autistic, or is autistic. And his son made a lot of progress, like super awesome progress after HBOT. So this doctor actually has his own clinic where he manages hyperbaric oxygen therapy for autistic kids in Turkey, and also they have an office in Belgrade, Serbia. So obviously Serbia is huge on stem cells, on HBOT, and actually their insurance, their government pays for it. So I'm going to put the lecture in the description below of Dr. Kinaci, so you can please listen to it. And I listen to it several times, and I make notes, and I study the subject. So it's very, very interesting. It's very, very informational. So he has a lot of patients that are actually making super great progress. Autistic kids that are making amazing progress, fantastic progress after sessions of HBOT. So anyway, back to Serbia, I just wanted to mention that over there, now I wish I had a different citizenship, Serbian citizenship, because in former Yugoslavia, it's a former Yugoslavia, obviously the insurance will pay for it, and they will not only take kids from Serbia and pay for them, but also from the region. But you will hear that mentioned in a lecture at the very end. So that would be a cool place to be if you have an autistic kid, obviously, because you wouldn't have to spend any of this money and the government will pay for everything. So, and I don't know if we'll ever actually see that day in the United States in our generation. I'm not sure. There's a lot of political, financial, legislation, red hoops that we have to jump through in order to even get the research going here. But anyway, back to my story. So after I started looking for the clinic for HBOT in Serbia, actually my mom is the one who came across the clinic for stem cells, for stem cell transplant. And so I was like, oh, let me read about that and let me learn about that. And this was like first time I'm even learning about stem cells. Nobody told me, not other parents, not the therapists, not the physicians, nobody, and I'm a nurse, but I'm not a pediatric nurse. And I didn't know anything about it. It's like a hush hush here for some reason in the States. But obviously there are so many reports of parents of progress their kids are making. By the way, I didn't tell you about Slava's progress. He's making a lot of progress too. Let me just mention this really, really fast. So he started saying hi clearly. I don't know if I mentioned that in my previous video. We're perfecting the word more and all done, working on it. And then he's trying to work on word cereal. And I don't know if you saw my last short that I posted a couple of days ago where he said yogurt, clear as day. Obviously, I wasn't ready for this video. I wasn't even dressed or anything. We're just sitting there having dinner. Well, he was having dinner. And I was feeding him. And he said, yogurt, clear as day. And I looked at him. I have a house camera, a home camera, indoor camera. And I was like, oh my goodness, I'm going to, make a video off of it. So if you didn't see that short, please watch it. So, and then, and the OT therapist said that he's trying to count 1, 2, 3, 4, 5, which is, we count all the time. When I brush his teeth, I count to 5 on the bottom and then 5 on the top. And, we count all the time. And also he's been babbling a lot. Like, how when kids start talking, and that's exactly what Dr. Kobinia, our doctor who did our stem cell transplant, that's exactly what he said, that they're not going to start talking sentences after stem cell transplant, like immediately. It's going to be a slow process. It's going to be like little kids when they start talking, like the toddlers, and they start babbling. And, he used to babble when he was about a year and a half. And he's babbling like right now, like he used to babble when he was a year and a half before he regressed. And you guys, I'm sure, can relate to what I'm saying. So, anyway, that's our progress. Now, where was I? I wish I had an audience so you can remind me. Where are my nursing students who can remind me where I was? Because I always get carried away and then I forget. But anyway, my mom found the clinic, right? So I started learning about stem cells and just watched many, many, many testimonies of parents, autistic children. And, they do stem cell transplant for other reasons too, for anti-aging and different neurological disorders and, pain, of course, and asthma and diabetes. And very few of them are approved in the United States. I know for pain, like the ortho pain, kind of like shoulders, knees, I know that's approved, right? Of course, we know for leukemia, it's approved. But very, very few conditions are approved in the United States. So for you to do it, you really can't do it. As far as I understand, you can't really legally do it here in the States. So you have to go somewhere else. So then I learned about different clinics in the world. And so there's one in Panama, there's one in Mexico, I think there's one in Israel. There was one in Kiev, and I think they were, okay, before we even proceed, let's talk about this. When we say stem cells, when I say stem cells, we're not talking embryonic stem cells. I know there's a big stigma and taboo about embryonic stem cells, and it's a moral, ethical issue for a lot of people. I'm not talking embryonic stem cells, and we're only talking about, actually, I'm going to be talking about bone marrow derived stem cells is what we did. And it's called autologous. Autologous is when from your own body, taken from your own body, put back into your own body. And then there's also allogenic, which means from donor cells. So, and donor cells are from placenta and umbilical cord. So those are allogenic stem cells. So most of the clinics that I found, there's one in Kiev that I was mentioning, and Dr. Kobinia, you'll see in the video below in the description. I'm going to put all the videos that I'm actually referring in this video. I'm going to include them, and I strongly, strongly, strongly recommend, and I'm almost begging you, please watch all of those videos because they're so informational, they're so amazing, they're fantastic. And doctor from India, Dr. Sharma, I'm going to talk about him in a minute. I'm tearing every time I watch his videos. His video, that particular presentation that I'm going to tell you about in a little bit. But anyway, so back to the clinics. So there was a clinic in Kiev, and I guess they were doing embryonic stem cells, maybe along with other ones as well. There's a clinic in Georgia, and they do autologous bone marrow transplant stem cells. Georgia, meaning former USSR Georgia, where my parents are from. I'm actually 1/4 Georgian. I don't know if you can tell by my darker hair. Anyway, but my mom looks very Georgian. My dad is from Georgia, but he's not Georgian. He's Ukrainian. Anyway, so there's also a clinic in Arizona that I just found out about not long ago, and I don't know how they do it because he's the doctor over there saying that they have their own laws in Arizona. I don't know, but as far as I know, it's not FDA approved in the States, so I have no idea how they do it in Arizona. So most of the clinics, and there's a clinic in Serbia that's a really big, and they're doing a lot of promotion. That there's a lot of videos on the internet, and they had a lot of patients that they used to be actually in Moscow before, and then I guess before the war, and then they moved to Serbia, to Belgrade. And I'm hearing right now they're having some kind of problems with licensure and stuff, so they might not be operating. So I'm not really sure, but don't quote me on that. Check for yourself. So most of the clinics that I found, they're doing allogenic stem cells. They're doing donor stem cells, and they also doing IV route through the vein, intravenous, right? So, and some of them even doing intramuscularly. We call it IM for short, into the muscle. Most of the clinics, they're doing it IV. From all this, I read a lot of research studies. And again, really quickly, research studies. When you guys reading research studies, you always have to look at the validity, reliability of the study, right? You know, the peer review studies are most reliable. The meta-analysis and systematic reviews are very reliable studies where they review a lot of different studies that were done before. So anyway, so when you do your own research, try to read those and compare and make your own, draw your own conclusions and make your decisions. You can use National Library of Medicine, PubMed, where you find a lot of these studies. And a lot of them are free, so you can just click on the link and it'll take you to where it was published. So a lot of studies that I read, they're stating that if stem cells are administered intravenously into the vein route, they're going to get lost in the heart and the lungs and get stuck in some other organs before they even get to the brain, which makes total sense to me. And if you know anything about anatomy and how the circulation works, of course, it goes in the blood from the peripheries, goes into the right ventricle, goes into the lungs, and then gets oxygenated, goes to the left ventricle, and then goes to all the organs. So stem cells, they're going to go, with the flow, the same route. So a lot of them are going to get lost in the lungs, then they're going to get lost in the heart, and they're going to go to the kidneys and liver and all the major organs, and of course the brain. But the brain is not the priority. So I don't understand really how, and kids are still making progress. There's still so many positive testimonies on YouTube. I mean, just watch. There's so many kids, they have profited from IV stem cells. But can you imagine if you put them directly into the cerebrospinal fluid and they're going to travel straight into the brain without being lost anywhere else in any other organs? They're going to go straight for that hypoxic, hypometabolic, Slava's here, hypoxic hypermetabolic area of the brain, his cells, they're going to travel straight into the brain, into the hypoxic and hypermetabolic area of the brain, especially like Dr. Kobinia, the video that I'm going to refer, and there's a link in the description below, and I will talk about it in just a minute. So in autism, one of the main areas of deficit is the left temporal lobe, where the speech production is. Thank you, Slava. He brought me a shirt. The stem cells, they go straight for that left temporal lobe of the brain where the speech production is located, because that's the main area of problem for autistic kids. And it's going to be, if you do scans, SPECT scan and a PET scan and I guess MRI as well, you will see that the areas, they're going to be in a different color than other areas of the brain. And you will hear about that in Dr. Sharma's lecture that I'm also going to put in a description below. So stem cells are going to go for those inflamed areas of inflammation, areas of deficiency, area of low oxygen, and they're going to recreate, and they're going to make more, they're going to become brain cells, they're going to grow more brain cells, and this area is going to become alive. And that's why kids after stem cell transplant, they start talking and they start functioning better. And you will hear from Dr. Sharma's lecture, and from Dr. Kobinia's lecture, and from Dr. Kinaci lecture, that the kids improve greatly in all aspects. I mean, socialization, speech language communication, social ability, sensory and cognitive awareness, and even health and psychological, and their behavior improves. And some kids almost completely come out of spectrum. Some kids start going to normal schools. They start talking, they start, making eye contact. Slava doesn't have a problem with eye contact. He's with sociability, he's very loving. He'll come up to you and pet you, and he kind of beat you like this, like spank you a little bit, and that's his way of petting, like so. But sometimes he does that too. So, but some kids, they don't make eye contact, and they just kind of locked in their own little world. And so stem cells, by the brain waking up and getting new cells and getting all, the oxygen from the HBOT, or the stem cells when they start growing and developing in the brain. So the brains are growing like the normal developing child, at age, year and a half, when they start, being more sociable and they start talking, and all of those processes that are going on in the normal child's development. So anyway, so I started researching different clinics, right? And so when I realized that it makes more sense when the cells are administered intrathecally, it's called intrathecal route, which means into the spinal canal where the cerebrospinal fluid is. So it's the same procedure as a lumbar puncture, LP, or we call it spinal tap. And it's done, I don't know if you guys have ever had it done for to test for meningitis, for example. Like in the emergency room, we do it when I used to work in the emergency room. Right now, I'm just working on the ambulance. But in the ER, we do it every day, several times a day. Doctors do it on kids, babies, adults. So it's a very routine procedure. And like Dr. Kobinia is mentioning in his video that you're going to watch, okay, they're anesthetists that do perform lumbar puncture and insert the stem cells into a child. They've had millions of training hours, and then they also perform this on thousands of kids. So they have lots of experience before they can even touch with the needle, touch the spine of a kid. So they have lots of experience, and this is a very safe procedure. Of course, their side effect, the main side effect is headache, and it's normal, and pretty much everybody who has a LP, lumbar puncture, or spinal tap, they will have a headache. So, and that's normal and something to be expected. So I found that I personally only found 3 clinics in the world that do intrathecal route instead of IV, intravenous route. And it's, Dr. Kobinia in Austria, the one that we went to. Dr. Sharma, Alok Sharma in India. He's the one that I've been talking about, and I'm going to put the link to his presentation below. He was presenting at the it's called, let's see, International Conference for Autism and Neurodevelopmental Disorders in Dubai last June. He was presenting right after Temple Grandin. And there's some other awesome speakers. I actually encourage you to watch the whole conference, but I'm going to put the link for Dr. Sharma. And his presentation is fantastic. Like I said, I cry every time I watch it because I watch it several times. So I found that and there's another clinic in Georgia, former Soviet Union, Georgia, and they do intrathecal route as well for stem cells. So then I had the three clinics to compare with, right? So first I had all of this, and I had to figure out autologous versus allogeneic, IV versus IM, intranasal and intrathecal, and all of these different routes of administration. And then, of course, I figured for myself, that makes more sense if it's given right into the spinal canal, it goes straight into the brain. And like Dr. Kobinia will mention in a lecture, he gives a medication called mannitol, which we administer in the emergency room for head trauma patients because of the swelling in the brain. Mannitol, it's a diuretic. I think it's a osmotic diuretic, and it's going to pull all that extra blood, all the extra fluid off the brain. You're going to pee it out, so to decrease the intracranial pressure. So anyway, so he gives mannitol to open a blood-brain barrier. I actually didn't know that mannitol opens a blood-brain barrier. Blood-brain barrier is a membrane in the brain. It's like a protective, God created, or whatever you believe, nature created protective membrane in the brain that protects the brain from offensive substances entering the brain. So Dr. Kobinia gives mannitol to open the blood-brain barrier when they insert the stem cells. So then when I narrowed my search down to those 3 clinics, so Dr. Sharma is amazing, hands down, fantastic. He wrote, oh my gosh, he wrote so many articles. Where is it? I'll tell you right now. I mean, he actually published chapters in books for autism, for stem cell treatment for autism, and several textbooks already, and it's mentioned in a lecture. And he's presenting all his research that he published. So it looks like he wrote, and it's not only on autism. I think altogether he wrote 172 scientific papers, published 24 books, and contributed to 19 textbooks. And treated 12,000 patients from 75 countries, and it's autism and cerebral palsy patients. So he's amazing. You guys have to watch. Please watch that video. You're seriously gonna cry. And there's also a couple of testimonies of 2 autistic kids that he shows in his presentation. It's included, and it's amazing. Anyway, so Dr. Sharma looks like he only makes 1 insertion into the pelvic bone where they get the bone marrow stem cells. So how it works is they make a puncture into the pelvic bone. It's called anterior and posterior iliac crest. So for Slava, they did 4 insertions. Dr. Kobinia does several to get the most stem cells. So that's why he does 4 punctures and then 1 puncture into the cerebrospinal fluid. Of course, they take some fluid out and then put the same amount in, not to disturb the volume of their CSF, cerebrospinal fluid. Otherwise, you're going to have a problem with increased ICP, intracranial pressure, and headaches, and all kinds of major problems. So they remove however much they want to insert. They remove first of CSF, cerebrospinal fluid. I don't know what they do with it. And then they insert the stem cells, the same amount. But so Dr. Sharma only does 1 bone marrow, puncture for bone marrow from 1 spot. Dr. Kobinia does 3 or 4. And to me, it makes more sense because he gets the most stem cells when they do that. So, and of course, Okay, I'm going to talk about the procedure itself in my next video. Hopefully my next video will be shorter than this one. I'm sorry, this one's going to be a little bit longer because this is the meat of the whole thing. I'm probably not going to make long videos anymore after this at all, unless I find a subject that I want to talk about. But I write papers better than I talk, honestly. So I rather write than talk, honestly. But so forgive me. Anyway, okay, let's go back. So anyway, so when I narrowed it down, well, we decided not to go to Georgia for different reasons because, Putin has his hand there nearby, and we don't want to get anywhere near that because we're kind of in opposition and we don't want to get in trouble. We don't want to get put in jail. So my husband and I. So we decided not to go to Georgia, even though I love Georgia dearly. I spent half of my childhood in Georgia. I used to speak Georgian when I was little. My grandmother used to live there. My cousin used to live there. Anyway, if anybody speaks Georgian, I know a couple of the poems from my childhood because I went to the kindergarten there. I lived with my grandmother for like a year and a half. So anyway, it was between India and Austria. Well, Austria, first of all, Austria was closer. My sister lives in Switzerland, so my sister said she's gonna go with me. So I'm like, okay, so we're gonna go to Austria. Of course, my sister's husband is from India, so we could have went to India as well together. But it's gonna be, longer flight, and it's hard. I didn't know how Slav was gonna be on an airplane. He was fine. He was great. So surprised. Knock on wood. So anyway, so we decided to go with Dr. Kobinia's clinic for the reasons that I just described. So also, he's a cardiothoracic surgeon, and for many, 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 many years, and from 1983 to 1985 or 6, I think 6, he did fellowship at Harvard. So he actually was a cardiothoracic surgeon for many years and actually did a bunch of research about that and made some inventions. In his website, which I'm going to also include in the description below, there's, please go to his website, visit his website where it's listed all his achievements and all the awards and all his inventions. And then about 13 years ago, he started doing stem cells. At first, they started doing, I think, for spinal cord injury, and they had some miracles too. It's like biblical miracles, like people getting up from the wheelchairs. I mean, not like immediately, of course, not as close as biblical, but So people started walking, people started moving extremities that they couldn't move. And it's after stem cell transplant for spinal cord injury. And that's another huge, 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 progress, and it's a miracle, and I don't know when we're going to utilize this in the United States. I hope it's going to be soon, but like I said, there's so many hoops that researchers and doctors have to jump through to even do research here in the States, that it's really, I don't even think we're going to see it in our lifetime. I mean, hopefully we will, but I don't know. I'm very skeptical. So anyway, so Dr. Kobinia, he has a lot of experience, and for 13 years they've been doing stem cells. Like I said, they started with spinal cord injury, and then they were doing cerebral palsy CP kids, and then they started doing autistic kids. And so I believe they already done 1,500 or 2,000. They operated on 2,000 autistic kids for doing stem cell transplant, bone marrow derived stem cell transplant, and they have success stories, and they have I think it's 85+% success. So overall, it looks like from the literature that I've read, all the research, and from Dr. Sharma's presentation at the International Conference for Autism and Neurodevelopmental Disorders in Dubai last June, and Dr. Kobinia's presentation from this couple from Israel. They have a website. It's called, and I'm sorry, I know, guys, I'm talking too much. I'm sorry. I hope you're not going to get confused. If you're confused, I can clarify. Just write me in the comments below, and I will clarify everything. So there's a couple in Israel. They have their own website, and it's called, and they do a lot of research and their own research. They have a lot of presentations from different doctors, and I think some testimonies. And they have 3 autistic kids, and their website is called Autism Essentials Israel. So I came across Dr. Kobinia's lecture through them. So I actually had to write to them later and thank them for, because if it wasn't for them, because Dr. Kobinia they don't advertise. They don't advertise because he's saying it's all word of mouth, and they're busy as they already have 3 to 5 patients that they operating on, autistic kids that they're operating on Tuesdays and Thursdays, and they're not even advertising. So this is all through the word of mouth, and because also in a lot of countries this is not approved by the government. In Austria, they have approval by their health department and the Supreme Court. So they can actually do it in Austria legally. So they're very busy and they're not advertising. So there's only one lecture that I found, not a lecture, but a presentation that he did on Autism Essentials Israel. And I'm so thankful to that couple. And if you guys are watching me, thank you so much. And some of the videos of yours I watch as well, but a lot of them are in Hebrew and I don't understand Hebrew. But anyway, so that's how I learned about Dr. Kobinia. So I'm going to put that video in the description below, obviously. So what else did I wanted to tell you? I wanted to tell you that research that is done or was done is not enough. And like I said, I don't know what the reasons are. It looks like Duke University in North Carolina, they were doing some research with umbilical cord stem cells, I believe. And then Dr. Kobinia mentions that in his video presentation. You'll hear that, him talking about that. And then they stopped because they concluded that mostly those kids that did not have any intellectual disability, kids that had higher IQ, they're the ones who benefited from the umbilical cord derived stem cell transplant. But other kids that didn't have high IQ, they didn't have positive results that they wanted to see, or positive enough results. So, but again, most of the research that was done still states that 80 and above % of kids have progress. And so, and Dr. Kobinia and Dr. Sharma both will tell you when you hear the lecture, they're saying that the younger the kid, the more chances of progress, and more progress you'll see, and more chances of improvement you will see. So when I read those research articles, when I listened to their presentations, and I said, even if it's 10%, and I can improve my child's life, if he falls within that 10%, if he was one of them, and I'm going to improve his life by doing this, I'm going to do it. And so, we didn't have the money. We had to borrow money from my parents, and we're going to be, paying them off this whole year. So, unfortunately, of course, insurance is not going to pay for it. We will talk about, I want to tell you more about the cost and about our trip. I'm not going to make it very long. It's going to be the next video, and I'm going to talk about Dr. Kobinia's recommendations. And some of those recommendations are pretty awesome. The nutritional recommendations to decrease inflammation, and recommendation for this magic mineral that pulls aluminum off of the brain. Aluminum that gets stuck in the mitochondria cells in the brain, and which could be a cause for autism in some kids. So this magic mineral, it's gonna be a little tease for you. I'm gonna talk about it in the next video. But let's see, what else did I forget? Prevalence of autism. Dr. Sharma will talk about this in his lecture. According to CDC, I think as of 2023, the prevalence of autism spectrum disorder is 1 in every 36 kids. 1 kid out of 36 has autism. And they're growing by leaps and bounds. If you look at the graph that Dr. Sharma presents, it's crazy. I mean, you can look on CDC for yourself, and 1 in 36 kids, and it's crazy numbers. So we have to do something. And you know what I said? I said, I don't have years to wait for more research, for the legislation to come through for us, for the politicians to come through for us, and and advocate for more stem cell research, to legalize stem cell research in the United States. It's going to be years, and we don't have years. Every minute counts with those little kids when they're growing and their brain is developing. And honestly, because Slav is almost 6, he's like 5.5 when we went to do his procedure. I wish somebody told me about this when he was first diagnosed. I would have done it right away, because 0 to 5 years old, the research, the Dr. Sharma and Dr. Kobinia, their own research that they did shows that they're having 95% improvement in kids 0 to 5 years old. So there's still 5% of the kids or 10% of the kids that are not improving, and there are other reasons. There's some, maybe they need more detox, and there are maybe other underlying problems. In some kids, they need more sessions. I'm sorry, not sessions. They need more. They need repeated transplant. So even with us, if we don't see enough results, because we're already seeing a lot, and it's only been 2 months, exactly 2 months actually, 2 months and 3 days. So we're already seeing a lot of progress. Even though Dr. Kobinia said you're not gonna, the progress starts 2 weeks to anywhere to 4 months is where you start seeing it and onward. So, but we started seeing it right away. He started saying new words a month, as you see it in my shorts, a month in my previous video. 1 month after the transplant, he's starting saying new words, and he's babbling, and he's trying to repeat words on a daily basis. So anyway, I want to wait a year, and then I want to either do HBOT, because I think honestly the hypoxic area, the HBOT will help with the oxygenation of that left temporal lobe, the hypoxic area, the area of inflammation, because oxygen, goes in there and heals, and also release of the extra stem cells. So, but it's a lot of sessions, 40 to 60 sessions for an hour and a half, to sit there just about maybe 3 times a week and I think Dr. Kinaci saying that every day they do sessions. That's a lot, that's going to be a lot. That's a difficult schedule. So I think going straight for the stem cells is, optimal decision. So anyway, let's see where. I'm sorry, guys. I know I'm talking too much. There's just so much I wanted to tell you. And even though I wrote a plan, I am not sticking to it. But I want to include everything that I was thinking about telling you, because I think all of this is very, very important, and I hope all of this is going to help you. And please take what I told you and do your own research. Okay, listen to the presentations yourselves, draw your own conclusions, make your own decisions, read the research articles, and it's all individual, of course. It's your life, it's your kid, so you decide. But let's see, talked about that. Oh yeah, one more thing I wanted to mention. When I was making my decision about what clinic we're gonna go to, I actually was talking to one of the clinics. They're operating out of Belgrade, Serbia, and right now I hear that they're having some kind of licensure problems as well. So, and they might not be open right now, but don't quote me on that. So, and I reached out to them and I said, so why do you guys do intravenous route versus intrathecal, meaning into the spinal canal? And they said, oh, we have better results with that. And I said, well, do you have some kind of research that you can share with me? And they said, oh, we don't publish our research. And that was like a huge red flag. And this is one of the biggest clinics that advertises like nonstop on YouTube. You'll run across them. They have, I think, the most patients that they did IV treatments. I mean, they still have patients with a lot of progress from IV route administration of the stem cells. But when they told me that they don't publish their research, I was like, that was a huge red flag for me. And I said, no, I'm not going to go there. Even though I was actually leaning toward them at first. And then I found Dr. Kobinia. And Dr. Kobinia, not only when he started talking mannitol, he started talking propofol, ketamine, all the medication that they use for sedation, and mannitol to open the blood-brain barrier. And I was like, oh my gosh, I know all of these meds, because I'm a nurse. It all makes sense. The way he does his procedure makes sense. He is super crazy about the sterility of the OR. He has some kind of special airflow in his OR. So anyway, so that's why I chose him, and he's just a sweetheart. And they're not advertising, and obviously, then you can just see that he is just sincere, and he really sincere wants to help children. And Dr. Kobinia, if you're watching me, thank you. And Dr. Irwin is great too. He works with Dr. Kobinia. I mean, the whole team is great, but those two physicians are amazing. And thank you so much. And we're having so much progress. I'm just like, that's why I'm so excited to share with everybody. And I'm sorry, like my speech again is really scrambled. Anyway, I'm not very good orator, I guess. But let me see. Let me just look at my notes really fast just to make sure I covered everything. Yes, I did that. Okay. Yes. Next video, I'm going to talk about our trip. I'm going to talk about how everything went, all the steps, that day of the procedure, the cost, and I'm going to share with you, like I said already, about Dr. Kobinia's recommendations. And there's some cool, awesome stuff, and a couple books that he recommended I'm going to share with you next time. And once again, I want to ask you to please subscribe if you haven't done so. Please put a like so YouTube will offer this video to more parents. And at the very end, I also wanted to mention that I'm a legal nurse consultant. I work with attorneys on medical related cases. So helping attorneys to figure out medical records and figuring out what really happened to the patient, or about their prior injuries, if they're related to the current injury, to the current pain that they're reporting, etc. So if you guys know any attorneys who litigate medical related cases, I would really appreciate the referral. It will really help me to work more from home and spend more time with Slava, and do more research about stem cells, because I'm going to be doing research for the lawyers. And actually, I'm already working a little bit. I'm just not starting getting my business growing. So anyway, I would really appreciate the referral. Thank you so much, and thank you for your attention. It's been an hour. Thank you for spending it with me. I'm sorry about, I'm kind of all over the place, but if you talk to my students, nursing students, when I was used to teach, they would tell you. But my students loved me, and they said that they always learned a lot from me. So I hope you enjoyed this video, and I'll see you next time. Okay? Slava needs me downstairs. I gotta go. Bye-bye. Bye.